Hi, everybody. I am Dr. Christine Anderson. I am a chiropractor who specializes in pediatrics and pregnancy. And specifically, I'm neurologically based. I'm a chiropractor that really focuses on the brain, and I do have my certification in childhood developmental disorders. So I help lots of children with lots of issues, um, all the way from prevention and being proactive in their development, which is what I prefer. But if they do have issues, I also can help with whatever's going on. And interactive metronome is one of the tools that I use to help with a myriad of issues ranging from ADHD, autism, learning disorders, dyslexia, processing disorders, whatever, or even just children who want to enhance their learning and memory capabilities, reading, athletic capabilities. So you don't necessarily even need to have problems. And although interactive metronome helps with all ages, my focus primarily is on children, but it is also useful for adults as well. So let's go right into this. So what is interactive metronome? Well, this is a brain training program that is actually working on the timing of the brain. So we don't think about this, but we have an internal clock within our brain that coordinates everything that goes on in our body. So our brain is the thing that controls everything. And we've got a right hemisphere and a left hemisphere that have to talk to each other. We've got different areas of the brain that do different things. And then we also have other structures that are involved that aren't necessarily part of the brain cortex itself that we think of the brain, things like the cerebellum. That's that little man bun at the back there, and even things in the brainstem. So this is going to help with that timing because everything depends on the timing of the brain, which is necessary for speech, coordination, learning, cognitive tasks, so things we have to, our brain power. And it's going to train the brain. So what it's going to do, sort of like mowing the lawn, right? You create a path in that lawn. If you take a lawnmower to it, it's going to create pathways or connections that over time, as you repeat, you're going to train the brain to move towards those connected pathways instead of information coming in and just being uncoordinated all over the brain. So what happens if our brain timing is off? Well, we can have so many issues, but speaking about kids, focusing, concentration, memory, impulsivity, organization, anxiety, depression, motivation, just their thought processes, coordination, and that can be physical coordination or mental coordination, motor tics. So a lot of our timing has to do with planning out what we're going to do with our muscles in a certain pattern. And we don't think of these things consciously, but in order for us to do a motion, there has to be a certain set of motor patterns that have to happen. And sometimes if they get uncoordinated, you can end up with a motor tic. And a whole myriad of other neurologic issues and whatever they present with, because we are talking about the brain, right? All right. So that means that interactive metronome, or you'll see it put as IM, can help with a whole bunch of things that we've got labels for. I'm not a label person because I like to deal with the individual in front of me. But if your child has a label or you think they might have one of these issues, it can certainly help. And there's a whole host of things because of what we're talking about with the timing. You have to have coordination with your brain in order to function and focus. And if you don't, you're going to be labeled with something like ADHD. If you're not able to have memory or can't coordinate the information coming in, you might have a learning disability or a processing disorder. As far as motor goes, if you can't coordinate the information in your brain and put it into a sequential motor pattern, you might have gross or fine motor issues or coordination issues just in general, all right? So that might be going on. This also can be helpful with things like traumatic brain injury and concussion. A whole bunch of stuff gets screwed up in that, and I have helped children with concussions and brain injuries where the medical neurologist didn't have anything for them. And I'll talk a little bit more about it in a second in conjunction with this. There was actually a paper that was written to see how both interactive metronome and something called brain balance could help with something like ADHD. And this goes into more of this functional aspect of the brain that I talked about, I think a couple of weeks ago, with functional disconnection syndrome. So I'll put a link to that in the description so you can go back and look at that, because this is all related. When I have a child coming in with a problem, I take a look at them specifically about what's going on and what I think is going to help them. And interactive metronome is one of those tools that I sometimes use. Well, I often use it. All right, so how does this work? Really, I'm going to show you a little bit about the DiHom unit. So it comes in a box. It comes in a box. Let me open this up. This is a brand new one. It hasn't been used. And you've got a whole bunch of equipment in here, but I'll show you as I describe this. So there's a pair of headphones in here, and these are actually smaller headphones, so they do really well at fitting children's heads. These are wired. I do not like Bluetooth headphones. You've got sensitive tissue right here. If you have Bluetooth on, or the iPods, that's a lot of electromagnetic radiation going in there. So we want wired headphones. You can use your own headphones if you want, but they do come with some very comfortable headphones, I have to say. So that's going to be hooked up to the device. This is the device, and you can see there's these little windows in here that will light up so that when a sensor is clapped, and so we've got, this is the sensor, and there's these hand pieces here. You put it on. This is the smaller one. So you put this on here, and then it's probably going to go on the other way. Hang on. So I'm going to put it on. It can go either right or left hand, and then you put your you put that on, and this goes on the clapping portion. So every time you hear that clap, that tap, it's sending an impulse into the machine. And I actually like wireless clappers. There's a battery in here because you can get wired, but the wired ones end up being like a jump rope. It gets a little bit crazy and unwieldy. So I do prefer the wireless battery operated clappers. Okay, you can get it wired though, if you need to. And this is set up for either. You can either plug it in with a wire, or you can have it with the sensor that's got the battery in it. There's also a tapper. So this is a foot tapper. Here's the wireless sensor here. So every time the foot will tap here, it connects to the device and sends in what's happening for the timing. So this is based on a millisecond, really fast. It can determine how close you are to being on the cue, because inside the headphones there's going to be a cowbell it's going to ding, ding, ding. And every time it dings, you're supposed to clap your hands or tap the side of your leg. There are different exercises you can do with this. And you can get creative. You can even combine things like have an alphabet on the wall and be like, okay, call out a letter, and then they have to tap it. So we can get creative, but the essence of it is you're clapping and you have to coordinate the timing of that clap, right? So it's the brain has to know how fast or how slow it has to bring the hands around for that clapping. So it's a lot more than just putting like a metronome on your phone or having a metronome that you would do music to, because you can't get the feedback. This is like a biofeedback device, because not only are you trying to clap on that sound, but you're getting the feedback and looking and seeing on the computer screen how close you are. Are you too fast? Are you too slow? There's also guide sounds that can be used in the ears, and I do that in the training if it's helping with the timing. Like for me, it helps, but if children are having problem with processing issues, it may be too much information. So this is where a program is tailored by me to a child's abilities based on the initial examination, so I can see what their timing is, and I have to meet them there and then take them along the way. And the beautiful thing about this is it's all done at home. This is a system that is affordable enough for you to have in your own home. You don't have to go anywhere. You don't have to come to my office for these sessions, which in time saving is amazing, and in money, because I don't have to physically be there while the tapping is going on. I am monitoring this after the session is done, and of course I'm listening to feedback from parents as they're doing it, how it's going at home, so I can fine-tune the whole program. So what does all this tapping do? I mean, that seems really simple, right? You're like, what? Wait, you're just tapping and this is going to do what? But there's a lot of jargon on here. Don't get sort of bogged down in it. There's definitely changes that they have found on functional MRI, and what that is it's not a static MRI. You have the MRI going on while a process is going on, so you can see the changes and where they light up in the brain. And they found changes in many regions, including that cerebellum. Remember I was talking about it, the little man bun down there, which is definitely important in our coordination and balance of muscle movement. That's the one where, you know, if you have a drunken sailor, they're toddling along, right? Prefrontal cortex is important because that is our frontal part of our brain, the more mature part that is necessary for impulse control and focus and organization, and our cognitive reasoning, you know, right and wrong. What am I going to do with this? Our personality is in there. Basal ganglia is something that is important with integrating a lot of things like feeling and movement and feeling inside your body and how anxious you are and all that type of thing. And then the cingulate gyrus is involved in cognitive flexibility. In other words, you're not just focused and stuck on one thing. You can take in some information or new information and adapt to your environment and have that connectivity within the rest of the body. So just talking a little bit more about what interactive metronome can do for a few things like ADHD. So again, remember, we are looking at focus and concentration being dependent on brain timing. So if a child cannot focus and concentrate, they might get this label. And this timing, remember, is involved in speech, coordination, learning of any tasks, whether it's physical or cognitive tasks, are going to rely on this timing. If your brain does not have timing, it's not going to work well. Now, there's this really cool paper. This is the one I was talking about a little while ago out of Harvard Medical School. And the title of it is Profound Effects of Interactive Metronome and Brain Balance Exercises on a Subset of Children with Attention Deficit Hyperactivity Disorder. And I will put the link to this paper in the description. But this is the one that I was talking about, where they looked at both the brain balance exercises, which is an aspect of that functional disconnection syndrome that I started talking about. And eventually I will be talking about functional disconnection syndrome and the relation of the brain hemispheres with issues like ADHD. But in this paper, their whole goal was to test and see if the interactive metronome and the brain balance exercises, if the children would have improvements in attention, impulse control, and activity on this quotient ADHD system, and in spatial working memory and spatial span on another system called CANTAB2, or CANTAB, sorry. They also wanted to identify, to see if there was functional connectivity, any changes associated with using the interactive metronome and brain balance exercises. So they did find there was a difference with both, and interactive metronome training was associated with increased connectivity between the hippocampus and the angular gyrus, precuneus, middle temporal gyrus, lateral occipital cortex, supramarginal gyrus, cingulate gyrus, and frontal pole. So a lot of these we already talked about. And the most important thing to know is that these pathways are going to be involved in things like emotions and impulses, and also in language processing, especially this angular gyrus, which is really involved in language processing, memory retrieval, handwriting, and ability to calculate mathematically, and also right and left discrimination. So all the things, right, kids are doing as they are learning. So they specifically also were talking about language being primarily in the left hemisphere, which I talked about already in the functional disconnection syndrome video. So go back and look at that. But the important thing is, this is one of those really great tools that can be used for something like ADHD, so we can get kids getting to the cause of what's creating that lack of focus and concentration, rather than medicating them, which just takes away the symptoms, but nothing changes in the brain. So here we can actually change those things in the brain. I also will put a special report on what goes on in the ADHD brain in the description, so you can find that there. Now, with learning problems, there was a study from Baylor University, and they found that students who did 15 minutes of interactive metronome training 4 days a week, so not even every day, like every other day, in addition to other things where they were working on their language and reading intervention. So, I don't know exactly what they were doing, but when they added the interactive metronome training, they found that those kids had a significant improvement in reading rate, fluency, and comprehension over students who just received language and reading instruction without the interactive metronome. And this is good with learning issues. Even if with kids with ADHD, they often have learning issues because they're not focusing. So this may be a component of why that works. And then with autism, or the autism spectrum disorder, this is often related to behavior issues, emotions, communication, that top-down control we're talking about with being able to use the brain to moderate what's going on in the body. A lot of that is lost, and those social connections are not there, which makes it very hard for these kids to know even what's going on with their own body. And so as we know and what we've talked about, this timing is the basis for things like attention, working memory, processing speed, all of which are needed for social interaction, attention, behavior, language, handwriting, all that stuff is needed. So this is why interactive metronome can be so great for these kids. It doesn't have to do with, are they smart enough? And a lot of them are super intelligent. It's more about that connectivity, and especially the social connectivity, which is so important. And Interactive Metronome is really the only training program that improves the timing in the brain in this type of organized, systematic, and engaging format for these kids, because it has to be fun, it has to be easy, and it's only about 15 minutes, so it's not hours and hours of tasks that they need to do. And research is showing that when you combine the whole body with a cognitive task, a thinking task, it is going to have a better outcome overall. All right, so it is so easy to incorporate interactive metronome into your busy life. Number one, the evaluations can be done in my office if you're local, or virtually if you're not local, or you don't feel like traveling, or you're not coming out of your house these days, or you live across the country or in another country. It doesn't matter, because with the beautiful things that we have going on now virtually, I can do an evaluation while you're doing this at home. So it can be done either or. And then a home unit, I just went over that unit if you missed it. A home unit is either given to you or sent to you. Based on that evaluation, I create a custom training program. And then your child's going to do that interactive training at home, about 15 minutes a day. I always say try to schedule it every day. If you try to schedule it every day, sort of like exercise, then hopefully you're getting in at about 5 times a week. Look, the more you do it, the more consistent, the sooner this happens. Those connections need that consistent use, because if you don't, you're going to get some grass that starts to grow, right? So we want to keep that path plowed or mowed. When your child finishes a session, I'm notified, I can look at it, I can talk to you and see if any tweaking is necessary, and then I modify as needed. It is so easy. And, once kids get going with this, they can do it themselves. You know how good they are with electronics. It's not difficult once it's all set up. So remember, interactive metronome training has been shown to improve attention and concentration, control of impulsivity, working memory, processing speed, auditory and language processing, academic performance, social interaction, organizational skills, self-confidence, handwriting, coordination, athletic ability. I mean, so much more, because everything really, we need that timing in our brain and in our bodies. So that's it. If you have any questions, this is where you can reach out to me. There's my phone number and my website, which you can contact me through. So if you have any questions, or if you want to talk to me about what's going on with your child, so we can get them possibly evaluated to see if an interactive metronome might help them, I would love to do that. And please give me a thumbs up if you like this presentation. Please subscribe if you'd like to know and get notifications when I am posting a new video. I typically come on every Tuesday night around 6:30. I know it's late tonight, but somewhere around there. And, share this with your friends. Guys, we need to help each other out. We need to create these communities and help other parents out, other moms. There's so many children out there who need help, and they're not getting it, or they're getting symptomatic relief, but it's not really changing their lives, and we need our kids to be healthy and happy. This is part of our job as parents, so that they can become happy, healthy adults and be independent and have a healthy happy, prosperous life. All right, that's it for this evening. I will see you next week. Bye.